leisure within the UK, but it's very much been a field of dreams type approach. Build it and they will come. And we need to challenge that a little bit more. So
Yeah.
actually, what is it communities want? What is it they need? Actually, the biggest challenge for us was the energy crisis. That put more facilities at risk than COVID. One facility telling us that their energy bill went to being over £1 million a
Oh,
year.
wow.
How do you make that
Yeah,
financially
market.
sustainable?
Hi, John. Before we dive in, can you please just tell us a little bit about yourself, your role in the company that you work for, GM Active?
Yeah, Jon Keating, head of business operations for GM Active. So GM Active is a collaboration of all of the different leisure trusts across Greater Manchester. So public sector leisure trusts that come together. So we've got a stronger voice and we can connect with the whole system across Greater Manchester. So with our strap line being "We Move as One." Our biggest ambition is to try and support the communities across Greater Manchester with the preventative and management of long-term health conditions, and making sure that we, as public sector leisure, play our role in terms of helping the communities.
Yeah, no, I think you're doing the awesome kind of job overall because that is really needed for the communities, especially like you were talking about the preventative care and organizing those communities for people. It's always nice to have those organizations. Can you just tell us a little bit more about the size of your organization, how many locations you've got, like how many people usually visit, all that?
Well, actually, GM Active, because it's the membership side of things, is actually very small. So there is one full-time employee, and you're speaking to him.
Mhm.
And but ultimately, our connected workforce. So from all of so there's 12 organisations that make up GM Active. Within that, you have so I'm connected to a workforce around 3,600 that are employed by one of the 12 member organisations. And across that estate, we manage collectively just short of, it's around 96 facilities. There's been some closures over the last few years. So it was 99, I think so. It's around 96 facilities across Greater Manchester. Not just leisure facilities either. Some of the facilities that we might operate are arts and culture side of things. So some museums, libraries, some homes. We've got golf courses. We've got theatres. So it isn't purely about leisure centres or gyms and swimming pools.
Okay.
It's much wider than that.
No, okay, so it's a nice variety. Can just trying to understand it a little bit better then. How does it work? If I'm a part of the community, can I use different facilities or how does it look like?
Um, so The reason, so in Greater Manchester, you've got 10 local authority areas. So everyone would say, well, why isn't GM Active 10 different organisations then? The reason it's 12 is because in two parts of Greater Manchester, so in Bolton and in Manchester, you've got two different operators so it's a bit of a split contract. And we have a very unique mix of something that we call national operators. So within that, we have a company called GLL that run quite a lot of most of the Manchester facilities. We have another big national company called Everyone Active that runs another one of the facilities in Manchester. Another national company called Serco Leisure that operate in Bolton. And then on top of that, we have Bolton Arena, which is a separate trust. And then we have two areas that are still what we call in-house leisure operations, so still run by the local authority, which is Wigan and Bury. And then in all of the other areas, so the other six local authority areas that I haven't mentioned yet, they are run by a local trust. So we have organisations like Trafford Leisure, Life Leisure, which operates Stockport. We've got Active Tameside. So they identify with the local area, Oldham Community Leisure, etc., Salford Community Leisure. So they identify with the area in which they are situated, and that's how it would work. Um, so it's quite unique in that we all come to, and then each of those 12 organisations, we would have a representative that makes up the board, the GM Active board. So we've got 12 voices plus my own that come into that board meeting once a month to discuss how we're going to work together, what's our wins, what's our solutions. Bearing in mind that Obviously, the communities across Greater Manchester are very diverse, very different. So it can't ever be a one size fits all. So it is looking at kind of what are the things that we can do together, and making sure that actually wherever you live in Greater Manchester, you have a service that looks the same, that you're able to access the physical activity offer, that you're able to access the gyms, the swimming pools, or any of the other things that we have within our auspices. So that's really really important. And then we have a number of different steering groups. So we have a steering group that looks at health. So our big, as I said before, prevention management of long-term health conditions. Therefore, we have a steering group and representatives from each of those areas that talk about health. What is it? What are our health objectives? How are we going to tackle that? What is it that we need to do moving forward? We have a people development one. So the workforce that we have now, okay, we need lifeguards, we need swimming teachers, we need gym
Yeah.
instructors, etc. But actually, what does that need to look like moving forward? We're thinking about the more of a lifestyle kind of approach of, okay, we need people to move more. We want people to be physically active. We want everyone to do that. So that's really important. Um, in terms of the people development moving forward, we have very recently looked at redeveloping, reassigning a children and young people steering group, and we didn't have that before. We did have it actually before the pandemic, but it restarted. It's restarted recently because the obvious thing is, well, if we're going to talk about the prevention agenda and preventing people from having long-term health conditions in the future, then we need to be speaking to children and young people being physically active from the earliest age possible, and make sure that that's a lifestyle choice that they
Right.
continue
Yeah.
with. So children and young people being really important. Data and insight group is really really critical to our needs, making sure that we're looking at actually what is it that the insight of what communities are telling us. I think over the past, leisure within the UK has, from the 80s, the 1980s, maybe even before that, but it's very much been a field of dreams type approach. Build it and they will come. And we need to challenge that a little bit more. So
Yeah.
actually, what is it communities want? What is it they need? And so
Mhm.
we react to that and say it isn't just, okay, here's a swimming pool, go and use it. Here's a gym, go and use it. Actually, our offer needs to be a little bit more led by insight, led by the data, led by what the communities are telling us. That's really critical. The pandemic for us was a challenge, as it was
Wow.
across the world. But actually, the biggest challenge for us was the energy crisis, and actually that was more, that put more facilities at risk than COVID did. There was lots of government help and support when COVID was around. But the energy crisis, when you think the amount of swimming pools that we've got across almost 100
Yeah.
facilities, that energy spike going up to one facility telling us that their energy bill went to being over £1 million a year.
Wow.
How do you make that
Yeah.
financially
Obviously.
sustainable? So therefore, there is an environment and sustainability group to look at actually what are the green sustainable solutions that we can apply, retrofit or new build, or whatever it might look like in the future, to make sure that our facilities are sustainable properly, and that if things happen in the world that actually make the energy spikes happen again, that we're a bit more protected against that. So that's really important. And then the final group that we have is the finance directors coming together just to share best practice, share sort of solutions that they're looking at across the different 12 organisations. So that's how it all works. Lots and lots of steering groups reporting into that board, and then looking at what are the collective wins that we can look at together.
Yeah. Sounds good. So, especially like the aspect that you mentioned about the preventative care, I think this is such an important topic, and understanding that actually you need to educate people around that as early as possible, as well as really, we are not at the times anymore just open your doors and everything is happening. You have to really put that effort out. I would really wonder, like, what exactly do you do to educate the population to let them know about your organization?
Um, the way that we work with a number of different business partners. Our business partner that organises our marketing, PR, comms, etc., is an organisation called Cornerstone that are based in Oldham. Um, what the guys from Cornerstone will always remind us of is that we're not a B2C organization, we're a B2B organization. So we're not directly having conversations with the communities of Greater Manchester. What we're trying to do is have conversations with the wider connected organizations to think about actually the NHS being an obvious one, transport in terms of making more people can get to facilities, the local authorities themselves. So it would be our member organisations that would be trying to have dialogue at a community level rather than GM Active itself, if that makes sense.
Yeah, it does. It does. Yeah. So you work on the B2B level to find the right partners to represent the organization, and then you go from there.
Yeah,
Um,
and I think we're fortunate in Greater Manchester because actually we have a combined authority. So with sort of devolved, locally devolved powers, and therefore we connect with that. The Greater Manchester Combined Authority is key to us to make sure, we are looking at things collectively together, and and other organisations like the Active Partnership, so GM Moving, and making sure that actually whole systems change is part of it. We can encourage people to do physical activity and move more and all the rest of it, but you get it's you can't outrun a bad diet. So we can get people to be physically active, but if actually they're not eating well and sleeping well and hydrating and all the rest of it, then we can only be part of that solution. So that's why that whole systems change has to come in, and we've got to be, physical activity is important, but it's not a panacea. It has to be that we are part of that whole system, not thinking that we're the only solution.
okay, sounds good. So if you could just expand a little bit more, maybe you've mentioned that already, but that's really interesting with your B2B network. Who would be your ideal partner? Who are you looking for?
Um, the way that we see things moving forward, what has happened over the last month, 2 months over the summer in the UK is the new NHS strategy. So the new National Health Service 10-year strategy. And there are three really critical things to us within that. One that talks about actually we want to focus on prevention rather than treatment. So prevent people from having a long-term health condition in the first place. The other one is moving away from hospitals and being able to support people within community. And then the third one is moving away from analog kind of records and analog solutions and look at what the digital and technology solutions are instead. So we think we're in a really strong position to be able to um, deliver against all three of those key step changes, essentially, particularly around that preventative agenda. So it really ties in with our strategy. So therefore, long story to answer your question, what we ultimately want to be is that connected partner to the NHS to help them deliver against those three step changes. That's just one part of it, but also working with education, working with the further education, higher education sector moving forward, because our workforce is going to need to evolve to make sure that we can do more of this. So actually working within education has to be important. Working with education for the purpose of actually educating children in the future, working with local schools, more of our 12
Yep.
members rather than the GM Active perspective. Industry itself, so working with food companies, working with pharma companies, working with the technology solutions that are out there, and lots more. As I mentioned before, there is something. So what Manchester have been working on over the last number of years is to make sure that we've got a transport system that is similar to the transport system in London. So that's been quite unique to us. We also, and a big part of that is 30% of households across Greater Manchester don't have a car. So
Mhm.
therefore, if we are putting on a physical activity, movement solutions, and things that we want people to be involved with, we have to make sure that we're connected with the public transport system. So
Yep.
that's really key for us as well. So it's how long is a piece of string really? It's there's so many different partners. If we're going to genuinely work together and make these significant changes to society to make sure that we're healthier, help try and um, prevent some of these long-term health conditions happening, then there are so many people that we probably haven't got long enough to try and list them all. But that's just a flavour of the changes that we need to make. Local authorities, the combined authority, transport, healthcare, you name it, and making sure that we're not just exclusively thinking about public sector leisure facilities, that we're actually thinking about kind of the private sector ones as well. What is the solutions that they can bring in? So in the UK, we have, and across certainly across Greater Manchester, you have what you call your budget gyms. You have kind of the mid market, if you will, which is more the local authority type stuff, and then you've got your premium market as well. We need to make sure that we're all working together rather than trying to compete against each other. You know, choice is important. So, what is it that they can offer that we're not offering? What is it the premium offer is out there? So, making sure there is something for everybody, and that we're all trying to, we're all pulling in the same direction, really.
Yeah, no, sounds good. Yeah, that's it's a big vision, big picture, like overall. That sounds like a massive project. Um,
It is, but we need more than one of me.
yeah, yeah, that's true. Yeah. But I also was thinking that because we're connected on the basis of an international conference that is coming up, like what are your plans? What's your vision regarding the location? Are you looking for partners in other countries?
No, the GM is in terms of GM Active, stands for Greater Manchester. So I don't think we would work beyond the breadth of Greater Manchester, because that would go against kind of what we're trying to do in the first place. However, what we are keen to do is make sure that we learn from others and we're able to help others. So, to two members, one member of the Geomatic board went to Australia recently, and presented at one of their conferences about kind of everything that we've been discussing now. And the CEO of GM Moving, which is the active partnership, also went there as well. So our influence across the world, that's just one example, but our influence to present and help people learn from what we're doing. We've been to lots of national conferences. I've been up to Scotland to present. Our chair goes kind of up and down the length of the country to present at various different events. Yes, we've got some experience of going internationally as well. So I think that that isn't just about us going to tell our story. That's for us to learn from others as well. And that's why the event that we are both going to be attending will be for me to kind of learn actually what's happening in other parts of the world that we can learn from and bring back to Greater Manchester and make improvements that we haven't maybe thought of before. So that's the importance for us. How do we influence change internationally and internationally, but also how do we learn from what has been successful elsewhere as well?
Yeah, no, that's a great idea. I find myself that traveling to different places and even just experiencing different like services, it can be just the same service, but you will always get a different experience and you can learn a lot of and see the gaps, which I call like I'm always on the lookout for the gaps. It's a really great opportunity and especially yeah, going onto active conferences and such definitely helps to see other perspectives and catch up the trends and all that stuff. So yeah, sounds like a really good plan. Well, it was absolute pleasure for me to connect with you and to interview you about you and what you do and your kind of mission and vision. Appreciate that.
Super. Right. Well, very nice to meet you, Lana, and I hope we speak again soon.
Okay, thanks, John. Thanks for your
Thank
time.
you.
Bye
Take
for
care. Bye
now.
bye.